And what is your name?
My name is Juan Perez.
And what do you do?
I'm a CNA at Joseph Recovery Center. It's a it's it's a subunit for the Center for Healthcare Services.
Okay. And what would you say is the mission statement of the program?
Um, the main objective of Joseph Recovery Center is to help people who have mental health or suicidal thoughts, and to help overcome those challenges, and to give them to help them back into society.
Okay. So kind of like a rehab facility.
Yes.
Yeah. So what type of services does the program provide?
Well, Social Recovery Center is a voluntary program. We do provide help starting off with Social Security, and if they do decide to stay, like more long term, because it's a short stay, but it's more long term care afterwards, a long term facility, if they choose to, or just find a safe place to go afterwards. We do provide group sessions, and you meet with the psychiatrist.
Oh, okay. But what do you mean by Social Security? Like, what is that?
The SSID, like your Social Security, like your money, your monthly money.
Oh, okay. I know what you're talking about. So, what type of professionals are employed in this program? Because I know you're a CNA. So, what other people do they hire at that facility?
It's psychiatrists, RNs, LVNs, caseworkers, CNAs.
So, what would you say are the human service workers' productivity expectations?
Well, for our unit is to be 80% or more of capacity with clients, and to find a safe place for them afterwards they leave. But it's kind of difficult because we have clients that don't want to follow the program and just want to go against medical advice.
Okay. Does that happen often at your location? Do people tend to just leave because they don't want to be there?
Yeah, or they're probably drug seeking, or whatever the case may be, have something important else to do.
Okay. And how many hours of paperwork are required each week?
We do about like 15 hours a week, but we're more hands-on with the patients, more monitoring, more like one-on-ones. Yeah.
But at the end of the day, you have to do paperwork, right?
Yes, document how they were that day or how they're acting, because we have more interactions, and when we transfer that, we pass that along to the psychiatrists and RNs.
Okay. So you, as a human service, worker, what would you say are some challenges that you encounter in this, facility or working in this environment? Because you've been at this job for how long?
Going on 5 years already.
5 years. So, what would you say are some challenges?
Usually we get some clients that just take advantage of the facility. They just don't want to work, and they come in and out whenever. And they just don't want to do what they're expected of them, and they just want a place to stay or free food. We also have clients that are really mentally unstable, and they're not suited for the program because they're not equipped, because they're supposed to be on the right medications, and sometimes they're not. At other times, it's just people who still have those suicidal thoughts, and they go through with it. That makes it kind of difficult.
So, how do state regulations affect this program?
The state regulates us by, it is a small, like a subunit, so we only restrict it up to 16 clients. Any more than that will be considered a hospital. Since we're so small, we can't hold more than 16.
So is it hard having 16 clients sometimes?
It varies. It depends on.
Like if it's just you working, because I know sometimes you know, they don't put people on the schedule, or they're just shorthanded, and you know, there are days when it's just you and somebody else.
Yeah, and it can be because 16 patients versus two employees, it can be a handful sometimes, especially if they're real psychotic or they have those thoughts and they want to hurt themselves.
So for the Center for Healthcare Services, what is the funding? Like, who funds that specific?
The majority of the funding is grant funded. That means we get grants to like the state and stuff. But we do get funding, like if we bill the clients that have insurance, we bill them for the services that we provided while they stay over there.
After being at the Center for Healthcare Services for 5 years, how would you say it has, or what are your views on human service workers? You know, like, is it a challenging field, would you say? Because, you know, you have to deal with mentally ill patients all the time, and people that aren't in their right mind, and sometimes you're not even trained for stuff like that. So how is it working? Like, how has it changed your views? Or
it's challenging, but also rewarding, because there's people who actually want the help and actually go through the program. It's kind of, it's good and bad days, but the good days are really good because it makes me forward to going to work and helping out people who really need help. And we see that. I mean, we see that. You know, sometimes we get those people who want to just like be a disturbance, but majority of the times people actually want the help, and we're glad to help. That's what we're there for.
okay. And thank you so much for allowing me to give this interview.
You're welcome. Thank you for interviewing me.
You're welcome. Thank you.